My name is Albert Girons. I'm an aquatic veterinarian, and I work in Ichthyovet. And basically, we are going to talk about histopathology as a tool for gut health assessment. In this talk, I will give first of all some very basic background information about ourselves, and then obviously I will introduce gut health and also histology and histopathology as techniques for the study of the intestine. Then we will focus on, in our opinion, the three main areas where gut health and histology interact, which basically is the histopathological diagnostics, the intestine histological scores. I will focus in our experience in CBAS and bream just to give a tight focus. And finally, the third would be morphometric measurements that can be performed on the intestine, also focusing on gut health. So when we speak about gut health, basically we are talking about having a functional intestine. Functional intestine basically is an intestine that is capable to uptake, to absorb the nutrients that we are delivering to our fish through the feed that we are giving to them. And at the end of the day, what we want is to have fish that grow fast and well with a strong immunity. So basically they are resistant to any challenges in terms of infectious agents or any other stressing conditions that they are exposed when they are in culture conditions. As you probably all know, gut damage is not an uncommon problem in our fish, and basically it can come from infectious and non-infectious causes. I will be shortly after I will be talking about some basic examples on bacteria and parasites that negatively affect gut health of our fish. Also, I would highlight the importance of feed. As basically as we more and more substitute fish meal, obviously we introduce vegetable raw materials that some of them might have a variable amount of substances or anti-nutritional factors that also can affect negatively the gut health of our fish. And obviously there are toxic agents, sometimes pollutants, and some other chemicals, even the treatments that potentially can affect also the integrity of the intestines, and also environmental conditions such as the temperature that also have a role in damaging the gut. Okay, so when we get this gut damage done, we have a lot of the integrity of the epithelium of the mucosa. So we have this loss of integrity. Then we have also an unbalanced microbiota. So usually these changes come next to problems or an alteration of the normal balance of bacteria that are proliferating or are present in the intestines. And also because of this loss of integrity of the mucosa, it's easier for pathogens and opportunistic infectious agents to get through the intestine, which actually is a significant port of entry for quite a lot of pathogens. It's easier for them to get into the fish and then produce disease. So at the end of the day, gut damage often translates into poor health, a reduction of health of our fish, and a reduction of growth. On the other hand, as I promised, we have histology and histopathology. Histology basically is the study of the morphology of cells tissues and organs using an optical microscope. This is quite a nice one here. And histopathology uses histology, this morphological study of the tissues, to actually study the changes that occurs in the tissue when there is a disease or a disorder going on. So through histopathology, we are able to do two very interesting things. On one hand, we can spot specific pathogens that are affecting that are a specific tissue, in this case the intestine, but we also are capable to study and to get information about which is the tissue response to this insult to the tissues. Just to give you a very brief information on how it works, histology and histopathology, I think it's a good, I always take a chance to remember that it's very important to fixate the samples. So if we want to study a particular tissue, a particular organ through histopathology, it's very important to fixate fast and well using basically 10% buffered formalin. That would be the most common fixative, and it's important to do it fast. So basically, as soon as the fish is euthanized, it's important to perform necropsy and take the samples that want to be analyzed through histopathology. Moreover, I would say that for tissues like intestine, these are especially susceptible to postmortem artifacts. So intestines are one of the tissues that very easily start presenting problems, start presenting artifacts that actually makes more difficult to take information and to analyze the tissues. So very important, this fixation. Once they are in the lab, what we do is to use an incluser, which basically uses temperature, pressure to take the tissues from the formalin to through a scale of ethanol, different types of ethanol, in order to dehydrate the tissues, take out the water, and to infiltrate liquid paraffin in order to get tissues hard enough to get hard enough tissues to get very thin sections, actually 3-4 micrometer thick sections, that later on we will stain in order to study them, as I said, under the optical microscope. Which type of stainings? I would say that hematoxylin and eosin would be the most common one for routine diagnostics, but also for the study of the intestine, as it provides quite good detail of the cells. However, I've also put this couple of other stainings that that are more focused for specific purposes, like the study of mucous cells. Basically, this modified hematoxylin eosin with Alcian blue, and then this Alcian blue periodic acid shift PAS-AV that also helps to differentiate different types of goblet cells, mucous cells containing different types of mucin, whether they are neutral or acidic. So let me explain you about, or let's remember what is the histological structure of the gut, or how under an optical microscope an intestine looks like. It would look like this. This is a part of a bigger size circular section of an intestine. We have these projections here that are what we call intestinal folds or villi, and basically we have here we have the lumen of the intestine. So here we would have the feet, and here the outer layer and all the organs around the intestine or around the digestive tract. So First of all, we would have here a layer of mucus just over all these projections. And then we have this kind of pink single cell layer that actually is the first part, intestinal, well, the first region of interest, let's put it like this, intestinal mucosa, that basically is integrated by enterocytes, which are lining all the intestinal folds, and less frequently, but also in quite significant numbers, goblet cells, which are the ones, on one hand, we have enterocytes, as I said, that are the ones responsible of the uptake of nutrients, the absorption of nutrients, and then goblet cells that are mucus-secreting cells that are the ones that are producing the layer, protective layer of the intestinal mucosa. The second region of interest would be the lamina that, together with the submucosa that it's underneath, these are basically regions made out of connective tissue that provides structure to the intestine. As you can see, there are some cell populations that's normal, not necessarily is inflammation. It's normal to have a certain amount of resident lymphoid cells, just basically for a very simple reason. These are, despite the intestine, it's in close contact with the external media, so there is always cellular. There is lymphoid tissue ready to start a possible inflammatory response in case of exposure to strange antigens. There are two other layers, the muscularis layer and the serosa, that are the outermost layers and basically end up giving this structure of tube-like that has this tube-like structure that has the intestine. Okay, so here is where, when it comes to the interaction between between histology and gut health. Quite often, in different situations, in farm situations, in R&D trials, it's quite a common question to ask ourselves if it's possible to assess the gut health, or basically we want to know how is the gut is performing in a specific fish population. Okay, so I think it's important to talk about three different techniques that involve histology and provides useful information. First of all would be the histopathological diagnostics, and then more specific techniques that involve histological scores of the intestine and morphometric measurements of the intestine. When we perform histopathological diagnostic, we are basically assessing, or we are monitoring the presence of infection, parasitic diseases, and other non-infectious conditions that are present in a fish population. So basically, through histopathology, we are capable to see if there are, as in this case, filamentous bacteria associated to the intestinal epithelium, the intestinal mucosa, that can be potentially a problem. We can also detect an over-proliferation of bacteria in the gut lumen, and a completely abnormal high amount of bacteria. Or also, in this case, like for instance in a viral infection, I should say this is from trout, not from sea bass or sea bream, but this is quite a characteristic inflammatory response of the intestine exposed to a viral infection, and basically we can detect this catarrhal enteritis going on in the digestive tract of trout in this case. So bacteria is one of the things that we can spot, bacteria and the tissue response that creates, but also in a sea bream, sea bus farm, I would say specifically C. bream, it's quite significant, the importance of intestinal parasites. Enteromyxum lay would be, I would say, like top of concerns in terms of intestinal parasites. It creates a very severe diffuse inflammation of the digestive tract. We can see different parasitic forms affecting the intestinal mucosa, generally also producing an atrophy and inflammation of the intestinal mucosa itself. But also we have other parasites like Enterospora nucleophila, which is significant in some areas in the Mediterranean as well, and also produces a quite hyperplastic response of the mucosa with quite significant inflammatory infiltrate involving macrophages aggregates in the submucosa as well. Other microsporidian, Enterospora is a microsporidian, I haven't said that, sorry. But other microsporidian parasites can be also found, forming more typically schenomas, surprisingly maybe not producing such an inflammatory infiltrate or inflammatory response, sorry. And other parasites that can be found and with variable amounts of inflammation associated to the presence of the parasites would be Cryptosporidium or Eimeria, Coccidia parasites. Okay, so this would be histopathological analysis. Then we can move into more specific scenarios where we need to be more precise because maybe the response, the inflammatory response that is going on is more subtle. It's not such dramatic. So we need to be a little bit more fine in the assessment of the intestines. That would be the situation of the histological scores. It helps to, as I said, to be more precise in the type of tissue response, but also it helps to have numbers that, to be honest, always are always helpful to compare populations of fish. So let's focus on, we said we are, you can hear me saying inflammation, inflammation, inflammation. So basically what it happens when there is inflammation? Basically any tissue from fish or from vertebrates reacts in a similar way. When we have inflammation in a tissue, we have an increase of blood flow. The vessels, blood vessels, and there is in the blood vessels, there is an increase of vascular permeability that helps to have an increase of inflammatory cells infiltrating in the affected tissue. And third of all, also there is a swelling, an increase of this tissue because of all this reaction that is going on in the tissue. Keeping this in mind, and keeping this in mind what we have just said a couple of slides ago about the structure of the intestine, we take three regions of interest: the mucosa, the lamina propria, and the submucosa. And we establish two parameters for each of these areas, these areas, and basically we give them a score. So basically we will be assessing following this criteria from 0 to 3, being 0 a basal level or basically no impact at all, up to 3 when we have a more extreme, more severe impact of that particular histopathological or histological feature. Okay, so basically we will be checking cellular infiltrates that are present in the intestinal mucosa, the lamina propria and submucosa, plus the presence of degenerative forms in the intestinal mucosa, presence of increased thickness in the lamina propria, and third, an increased presence of congested blood vessels in the submucosa. Why in the submucosa? Because basically it's that area that contains blood vessels. This way, what we get is a histological score for each of the histological features that we are assessing, but also we can add, like this, we can add all the scores and getting a total intestine score ranging from 0 to 18. Just to give you an example, that would be the evaluation of the cellular infiltrates present in the lamina propria, and basically you would have a 0 when you have a very thin lamina propria with no cells going on, then a 1 when we have just this small foci of inflammatory cells, but mostly no cell, very small number of cells, so mild impact, and then increasing numbers of infiltrating cells in the lamina propria in scores 2 and 3. So if we take an example, basic example, but I think interesting, of this comparison between a regular diet, regular diet for bream that will be used as a control, and we compare it with a supplemented diet with a feed additive, and we want actually to see if through histological scores we can show an improvement of the gut health of gut health. Okay, so the first of all, we will be scoring all the intestines from different areas. We will have samples from the foregut, the midgut, and the hindgut, from fish that are coming from that are being fed control diet, regular diet, and supplemented diet. And we get all the scores from these 6 different scores from these 6 different regions. At the end, what we get is individual average individual scores for each diet, for each region, and for each histological feature. And probably more clear, more useful is when we add all the individual scores, all the individual average scores, and we end up having an average histological score for each population and for each region. So basically we can see, and probably with a graph like this it's easier to see, that we have invariably from which area of the intestine we are looking. So we can look at foregut, midgut, hindgut. In all these 3 regions we have the same trend, where basically we have a reduction of the histological score when we are supplementing that particular feed additive. So this is one of this is the first type of solution, diagnostic solution, that it's proving helpful to assess the gut health of our fish. The second one would be morphometrics. Morphometrics is based in basically what we do is we digitalize the sections, and then we get we keep in mind one thing. When we have inflammation, we have a reduction of the epithelium, a reduction of the generation of the epithelium, and then the intestinal folds are starting to degenerate. So we have an atrophy of the villi, of the intestinal fold, and then we have a reduction of the villi height. Okay, so keeping in mind this concept, what we try to investigate with morphometrics is to measure, to take different measurements that can be used as indicators of this reduction of villi height, of this atrophy of the intestinal folds, and at the end of the day can be useful as indicators for gut health. So we measure these 4 different parameters: internal diameter and external diameter. So external diameter being the full diameter of the intestinal section, and then external perimeter, being internal perimeter, like the imaginary line that is outlining all the intestinal mucosa. And again, in a situation where we have a control diet that is compared with a supplemented diet, what we see is that the external diameter internal diameter ratio, it's higher, it's bigger. When you have a well-developed intestinal folds. So sorry, that would be, as you can see, it's 13% bigger in the supplemented diet. This ratio, the smaller is the ratio, the more atrophy, that particular intestine section presents. Similarly, with the perimeters, also we see that the internal perimeter external perimeter ratio is higher. It's higher when we have a better, well-developed intestinal mucosa. So again, what we get is the intestinal, the supplemented diet. Sorry, the supplemented diet again presents with higher average ratios when compared to control diet. Okay, so just to finish, some alternative measurements that can be performed are actually quite intuitively the bili height. So basically measurement of different bili, different intestinal folds in order to get an average height for each fish of the of that particular region of the intestine. And as I said, it's depending on the aim of the study, but also morphometrics quite often can be used to study mucous cell related data, including total number of mucous cells, average size of mucous cells, and percentage of acidic or neutral mucins, well, mucous cells containing acidic and neutral mucins. Okay, so that's my last slide, and basically just to give you, to wrap up, 3 conclusions. Very basically, that gut health obviously is important to have fish that grow well and are resistant to stress, including diseases. Then second, that histopathological study of the tissue response is actually providing valuable information that can be applied for gut health. And hopefully you will agree after this talk with me that actually histological scores and morphometric data can be used as gut health indicators. Very much for your attention.